I am a genetic counselor.
When I'm asked what I do as a profession and I describe my role as a genetic counselor, I usually get 1,000 questions. And I love it because then I get to describe all the different things that a genetic counselor does with patients, doctors, and other medical professionals that interact to provide health care.
I think genetic counselors do touch patients in lots of different ways, and historically it's always been one-on-one in a medical setting.
Beyond that individual patient, and it's more about kind of what is the broader impact as genetic counselors we can have on healthcare.
I am a genetic counselor.
I have counseled patients and families who have literally gone decades without a specific genetic diagnosis or without understanding the cause or familial impact of their disease.
I feel like oftentimes patients get so overwhelmed with all of the jargon, with all of the medical terminology.
So I feel my value as a clinical genetic counselor is to be able to serve as a translator for these families. And because they can then understand what's going on and what the genetic testing means and what the results mean, they can become partners with the scientists and with the clinicians.
By educating healthcare providers, in turn educating the community about genetics and genomics.
I am a genetic counselor.
Like most genetic counselors, I am a tireless advocate for my patients. And it's not because I have to, it's because I want to.
As a consultant to a company that does a lot of genetic testing, and in that genetic testing where they've used me is to say, so what do you think about this? Or do you see any potential problems with this? Is there something we haven't thought about? So that of course makes you feel great.
I, as a genetic counselor, serve on many different committees, national and federal committees. As a genetic counselor, I'm able to come in representing the genetic counseling profession and also thinking about our patients, our consumers who go through these healthcare systems.
When I work with the laboratory, sometimes I am the voice reminding them that it's not just a test, that there's a patient and a family that's depending on the results.
I am a genetic counselor.
What excites me the most about becoming a genetic counselor is just the opportunity to work with patients and bring genetic medicine, which is essentially personalized medicine, into their quality of healthcare.
As a program director, I am responsible for training genetic counseling students who will be the future genetic counselors providing this valuable service for all of our patients and families.
As a genetic counselor who conducts research, I'm looking at ways that we can better deliver genetic information to patients.
Genetic counseling is a major part of today's movement toward personalized healthcare.
Research I do is research that helps understand how people use genetic information to their benefit and how we can use that evidence to help our patients.
As a genetic counselor in public health, I focus on healthcare delivery systems and how genetic services fit within the overall healthcare delivery system.
My job impacts an entire population.
I am a genetic counselor.
As a genetic counselor over the years, I feel that I've had the opportunity to have positions in many different areas of medicine. And I feel that the impact that I've had over the course of those many different opportunities is really the opportunity to be the voice for my patients.
So I feel like a bridge as a genetic counselor between the science that is advancing very rapidly and the people and the families on the front lines of these diseases.
I know I'm making an impact because patients and families tell me I am every day.
I am a genetic counselor.